What's up, guys? How's it going? Cade Moore with More Muscle. Today, we're going to be talking about oxygen and inhalation therapy. Guys, there's people that have hypoxemia, cystic fibrosis, and asthma. Guys, these diseases are going to cause, you know, the oxygen not to go into the cells properly, and this can cause problems. So, guys, we want to measure their oxygen saturation with pulse oximetries. And this is, you can put on their toe, their earlobe, their fingertip, whatever it is. This is a probe, guys. It's a battery that's going to measure how much oxygen saturation is running through their body. And guys, you want to make sure the polish, nail polish is removed, and you want to make sure that hand is getting adequate circulation. Guys, a lot of times when I'm taking, oxygen saturation on a patient and their hands are cold, usually means that their hands aren't getting proper circulation. And make sure that patient is in a comfortable position. And always make sure you try it a couple of times on different fingers just to make sure that it's actually working correctly. You want to move the probe every 4 to 8 hours or per your facility's policy to make sure you don't have that skin breakdown. And you want to make sure that the child's expected range should be like lowest should be around 90. You want it to be around 95 to 100, but with an expected disease, 90 is about right there. Guys, COPD is about 88 to 92. COPD. You want it to be 88 to 92. But for children, you want it to be, more than at least 92, 90, somewhere around there. You want it to be above that minimally. And if they're not, you want to make sure the sensor probe is placed properly. You want to confirm the oxygen delivery is functioning correctly. You want to place the child in semi-Fowler's or Fowler's position. Guys, that's sitting up because that's going to help the patient breathe better and maximize ventilation. When patients are laying down on their side or whatnot, it might be harder for them to get that proper ventilation. You want to encourage deep breathing. You want to report any significant findings, to provider. You want to remain with the child and provide emotional support to decrease anxiety. The expected reference range is about 95 to 100%. Acceptable levels can be from 91 to 100%. And some illnesses can even allow for, your oxygen saturation to be 85 to 89%. And guys, results less than 91%. You need to make sure they get on oxygen saturation. You can use the cannula or the mask or whatever it is. They just need to have that oxygen. Especially, like, for example, I live up in Utah. Utah is a high elevation place, around 6,000, 5,000 feet elevation. Some places are even about 7,000 up in Heber. So guys, those high elevations, it might be harder for someone with anemia or, some other respiratory illness. It might be harder for their bodies to, get proper oxygen saturation. So what you can do is you can bring them a tank of oxygen and you can hook them up, and that can give them adequate oxygen. And guys, anything below 86% is a life-threatening emergency, and it's very dangerous. That's one of the most important things is patients that need to be getting enough oxygen, right? The next thing we got is nebulizer aerosol therapy. Guys, this breaks up medications into particles and disperses them. And it's kind of looks like a humidifier, humidified air. They're breathing it in. And instruct this, this can take about 15 minutes. It's, a mouthpiece, a mask, and you inhale. And you want to include, monitoring vital signs. And you want to encourage the person to take deep breaths by the mouth. And you want to assess their vital signs, assist the patient in taking this nebulizer if they need it. Then there's the metered dose inhaler or dry powder inhaler. These are handheld devices that allow children to self-administer medications on, an intermittent basis. You want to remove the cap, shake 5 to 6 times, attach a spacer, hold the inhaler with the mouthpiece at the bottom, hold the inhaler of the thumb near the mouthpiece, and you want to open your mouth and hold the inhaler approximately 3 to 4 centimeters away from the front of the mouth. And you want to close your mouth, or you could close your mouth on the method and make sure your lips are sealed, and intake with the MDI, which is the meter dose inhaler. You want to take deep breaths and exhale. You want to make sure you take a deep breath that lasts for about 3 to 5 seconds. You want to hold your breath 5 to 10 seconds. And if an additional puff is needed, you need to wait for 1 minute between puffs. And guys, some complications include inhalation is too rapid, inability to coordinate inhalation with the spray, and you want to make sure the patients are holding their breath properly for a good amount of time. Guys, next is they can cause fungal infections in the mouth, and you want to assess the mouth for manifestations of infections. You want to make sure the patient or the child is rinsing their mouth after administrations. Guys, another thing is you can do is chest physiotherapy. Guys, this is big for cystic fibrosis, where they have excess mucus and they have basically excess mucus, and it's harder for them to get oxygen. Chest physiotherapy includes manual and mechanical percussion, vibration, or coughing, forceful coughing, or breathing exercises to help, loosen respiratory secretions. And yeah, guys, so thick secretions with the inability to clear airway. That's why you're gonna do chest physiotherapy. You can kind of pat them on the back. You can have them kind of lean down so they can cough out that, excretions. You can have them drink some water so the secretions kind of not block the airway. Some contraindications, so you don't want to do it if they have a decreased cardiac reserves, pulmonary embolism, or increased intracranial pressure. You want to schedule treatments before meals or at least 1 hour after meals. You want to administer a bronchodilator, medication, or nebulizer treatment prior to drainage if prescribed. Intracranial procedure nursing actions. So you want to perform hand hygiene, provide privacy, explain the procedure to child and parents, ensure proper positioning to promote drainage, apply manual percussion. Electronic percussion is applied by a vest device worn by the child. Have the child remain in postural drainage for 20 to 30 minutes. You want to discontinue the procedure if the child is feeling faint or is dizzy. And you want to perform lung auscultation, so you want to listen to the lungs, and you want to assess the amount, color, or characteristics of the secretions, so that's like the spit. And you want to document interventions and repeat this throughout the day, 3 to 4 times per day. Guys, that can help, especially with cystic fibrosis or anything where you have that excess mucus, and that can definitely help. You can also suction. You can apply cannulas, face masks, oxygen hoods, face masks, whatever it is. But each level, has a different type of amount of oxygen it's going to deliver. I think, for example, a cannula has like the lowest, and then when you get to a mask, you're going to get more oxygen. So just depending on how much oxygen the patient or client needs, that's going to help with them. And you want to basically figure out what you want to give them, based on their oxygen saturation. You can suction them, and you can also, if you have to, you can do an artificial airway if they really can't breathe. That's a tracheostomy. That's basically an incision in the throat to help them get adequate oxygenation. There's a guy that actually had a car accident, and he had a tracheostomy just because he needed the artificial airway to help him breathe. And yeah, you want to make sure positions are changed every 2 hours. You want to keep an emergency tracheostomy, and basically that's about it, guys. Airway is very important. Most important thing, once someone's airway is cut off, they are at risk for dying. So asthma, big thing, allergy, that can cut off the airway. So thanks for watching, guys. Subscribe.